Building a government-led social safety nets delivery system in Somalia through a public-private partnership. There is a game changer in place in Somalia that has made Somalia a global lead in digital technology. This has led to creation of an agile mobile remittance and cash transfer system that delivers directly to the households. This could reduce poverty in Somalia. This advanced mobile payments system makes it the preferred mode of delivering cash. But not all the vulnerable households are covered by these transfers. Remittances don't reach everyone in Somali society. Naturally, they are received by family members in Somalia from family members abroad, and they are concentrated within particular extended families. Those households that do not receive remittances or other safety nets are likely to be more vulnerable, particularly in times of crisis, and are more likely to resort to negative coping strategies, such as sale or consumption of assets, consuming smaller portions of food, or taking children out of school. These households are more dependent on the natural environment and agricultural economy and found in the currently inaccessible areas. How can this vulnerable population be assisted and protected? And during a crisis such as a drought, when the vulnerable population increases, how can everyone affected be protected and helped? A government-led national social safety net system can be established to target the vulnerable households in Somalia. The existing, well-developed mobile network is a game changer, which can be tapped into to create a usable, functional, and effective government-owned cash-based safety net system and a social registry. It can be put in place and be managed and implemented jointly by government and private sector partners. Somalia is a global leader in cell phone coverage and use of mobile network operators, MNOs, for remittances. More recently, during the 2017 drought, the same mobile network was used by development organizations to produce cash transfers to vulnerable households. The development organizations have also conducted poverty and vulnerability assessments to determine to whom they should provide cash transfers. If all this data on the who and how many and where and for what benefit is integrated, it will essentially become a beneficiary registry. Integrated Beneficiary Registry, cash transfers, social pension, health insurance subsidies, social energy tariffs, emergency assistance, labor and training services, other programs. Integrated Social Registry, indicator of demand for social programs. This integrated beneficiary registry can, over time, be converted into an integrated social registry. For example, the data held by mobile network operators, MNOs, on receipt of remittances can be integrated with this database, which can help to identify households that either don't receive remittances or receive them infrequently. It would become relatively easier to identify the households that should receive safety net cash transfers. Cash transfer programs, social pension, health insurance subsidies, social energy tariffs, emergency assistance, social services, other programs. Combination allows for profiling the population, tracking of coverage, gaps and overlaps, policy analysis, budgeting and planning. Work has begun by a mobile network operator on building an online platform for organizations that will compile all the beneficiary databases of different organizations sending cash transfers to households. The mobile network operator has the information on who is receiving remittances, cash transfers, how much, and when. It also, therefore, has the information on who is not receiving any cash transfers at all, or too little and sporadically. If government capacity were to be built up to be responsible for a national social protection program, A smart and practical way to do this would be to connect all the dots and all the pieces already in place. Government would partner with the MNO to link into databases of beneficiaries, create an integrated database, and further triangulate these with their own poverty assessments to further refine vulnerable groups. Then, it would be able to direct MNOs to transfer government cash transfers to vulnerable citizens identified in this integrated database. Those who are not receiving any transfers or very little transfers would be the first choice for the government-owned SSN cash transfers. Somalia is a global leader in digital technology. It has the potential to be a global leader in reducing poverty and vulnerability and delivering social safety cash transfers to individuals and households for investments in nutrition, child development, health, education, housing, and livelihoods. Such a system could also be used to provide all Somalis with a cash transfer which ensures a universal basic income for all.